Hello, this is Hua Yang. I am a current student at Rasmussen College, and this is my PowerPoint presentation on diabetes mellitus. So, introduction. In this presentation, we will be covering um, what is diabetes mellitus. We'll go over how a person developed diabetes mellitus. In this category, there are two contributing factors on how a person developed this condition. We will also be looking into the signs and symptoms, the short-term conditions and its symptoms, the long-term conditions, and the treatment. So what is diabetes mellitus? It is also known as diabetes type 1. It is a pathology disease of the pancreas, which causes insulin deficiency, and in this, it causes high blood glucose, or sugar in the bloodstream. So, diabetes type 1, a pathology disease of the pancreas that affects the beta cells. So, what are beta cells? It is a unique cell in the pancreas that stores or produces the hormone insulin, which is necessary for breaking down sugar to use it as energy. What is insulin? It is a hormone produced in the pancreas. It allows the body to use sugar or glucose as energy and store glucose for future use. Insulin, it regulates and balances the blood glucose level. How does a person develop diabetes type 1? So researchers aren't quite sure as to how a person developed diabetes type 1 or how it came to be in a person. But what they do know is it is genetic, which a parent is a carrier of diabetes type 1 or inheriting the autoimmune, which can be triggered by environmental factors. If one parent is a carrier, the child has a 2 to 3% of developing diabetes type 1. If the parent was diagnosed before age 11, the child has a higher chance at a 30% of developing. However, if both parents are carrier, that put the child right at a 30% of developing diabetes type 1. Autoimmune can be environmental trigger, which can be changes in weather, which tend to develop in colder climates. It can be triggered by virus. It can be triggered by a certain kind of food or chemical and toxin. So autoimmune is when a person's bodies attack its own body. So in this condition, the beta cells are being destroyed. So, a person developing diabetes type 1 involves inheriting the gene and the environmental trigger, which is the autoimmune. It is usually diagnosed in young children and adolescents, but it may develop in adults in their late 30s or early 40s if they carry the autoimmune trait. The signs and symptoms of diabetes type 1, excessive thirst. Now, excessive thirst can be caused by many factors, such as exercising or out in the sun. But in this case, there's just no satisfaction after consumption of water. Frequent urination, because kidney absorbs the sugar in the bloodstream. Blurred vision. High blood glucose causes the lens in the eyes to swell. The person may experience dizziness, which may be caused by the dehydration, bypassing frequent urination and excessive thirst. The person may be fatigued, the lack of insulin to use sugar as energy causes the person to be extremely tired. Excessive hunger or increased appetite. Now, because the glucose cannot enter the cells to be used as energy, and the lack of insulin make lack of energy, so it causes increased hunger. Unexplained weight loss. The lack of insulin to use sugar as energy. The body breaks down fat to use as energy. Slow healing of wounds because the high blood glucose leads to poor blood circulation. Genital itchiness. Sugar passing in urine poses the area as a suitable place for yeast infection. Nausea and vomiting. Now, as the blood glucose rises and falls, it interrupts the metabolism. The person may need to seek medical attention or admit to emergency if the person experiences nausea and vomiting, a temperature, pain in the stomach, fruity smell on breath, serious loss of appetite. So the short-term conditions of diabetes type 1, hypoglycemia. This is low blood glucose, so low sugar in the bloodstream, which may be caused by too much insulin medicine, not enough food, too much exercise. The symptoms in hypoglycemia, the person may experience hunger, feeling nervous, sweaty, weakness, shakiness, and confusion. Hyperglycemia. This is the opposite of hypoglycemia, which causes high blood glucose. It may or may not show the symptoms in hyperglycemia. Causes ketones in the blood or in blood. The symptoms: the person may experience tiredness, blurred vision, increased thirst, increased hunger, frequent urination. Now, ketones in high blood glucose are known as diabetic ketoacidosis, DKA. Insufficient insulin to convert sugar as energy for daily activity causes the body to break fat down for energy. So in this process, it creates ketone in the bloodstream. The person may detect fruity smell on the breath, stomach pain, nausea or vomiting, dehydration, and it can make the person very sick. The long-term conditions of diabetes type 1. Kidney damage may result in kidney transplant. Damage of the eye. The person may become blind. Hardening of the arteries. Now, in this, it makes it difficult for the blood to reach all parts of the body, which may cause high blood pressure and putting the person at a higher risk of heart attack and stroke. Nerve damages, which is common in the feet and legs. So it causes a sensation of numbness, tingly, burning, or pain. The person may lose all feeling of their feet, and along with the foot sores. The stomach. It causes food to digest slowly, and the person may feel bloated or nausea. It may lead to constipation or diarrhea, and this makes it harder to maintain the glucose level. The bladder. The person may not be able to feel if the bladder is empty even after using the toiletry. It may cause infections of the bladder, and it also affects the sex. In men may have difficulty getting or maintaining an erection, and in women, the woman may have problems with lubrication or sensation. Now, treatment for diabetes type 1. Taking insulin medication, injections. There are a few options here, which are fine needles with the injection of insulin, syringe, insulin pen, the insulin pump, which is a device that is worn outside of the body. It is connected to a catheter that is inserted under the skin of the abdomen. Blood glucose monitoring. The person is required to monitor their blood glucose levels at least 4 times a day or more, which is recommended by the American Diabetes Association, that the person tests their glucose levels before each meal or snack, before bed, or before an activity such as exercising. Exercise, although the person who detect the ketones in their bloodstream, exercises does not apply to that person, as the person's body is already breaking down fat. So the person may need to consult with their doctor and finding the right exercise for such as walking, aerobics, jogging, swimming, or seeing if high intensity exercise is a better fit or not. It is recommended that at least 30 minutes a day, most days of the week. Now, exercising may drop the glucose level below average. So a person may have an adjusted meal, or they may have a snack before or after the exercise to raise that sugar level. Nutrition. The person may want to focus on high fiber, low fat, which in fruits, vegetables, whole grains, refined carbohydrates. And exercising is not only just for diabetics or anyone with any pathology condition. It is recommended for everyone to include exercise in their daily activities to maintain a healthy lifestyle. Statistics. In 2012, a total of 29.1 million people had diabetes. 21 million people diagnosed with diabetes, and 8.1 million people with undiagnosed diabetes. Here are my references. Thank you for your time, and hope you learn a few things here.